Hey guys, so I wanted to take a minute to make a video and talk about one of the hot topics that I feel very passionate about, and that is the mental health system that we have in place in America and in our individual states, and how broken that system is. So this video is going to address some statistics and some things that I feel like have been kind of pushed under a rug. If you haven't already, please subscribe to my channel to continue to get updates, and also to get updates regarding Robbie from our episode on Dr. Phil. Okay, so I'm going to use statistics from my state because that's where I live and that's what I know the best. And so it's pretty equal from state to state for the most part. The systems are very much the same, and they're all very flawed and very broken. Okay. So, access to mental health care. Statistically speaking, in my state, if you are a minor that is age 18 and under, you automatically qualify for what's called CHIP, and your parents would have to pay for your CHIP based on their income. Oftentimes, you might qualify for free CHIP, and so CHIP offers access to both healthcare and also mental health. Now, most people who have mental health issues, like severe mental health issues, have already crossed that threshold of age 18, statistically speaking. And so I'm going to use some of the statistics that I came across for my own individual state. Okay. So, over 4% of the population is made up of people who have severe mental health issues. So that's things like schizophrenia, bipolar, major depressive episodes. They might be self-harming, cutting, all sorts of personality disorders, kind of all balled up into that severe category. So over 4% of the population has severe mental health that needs regular high-end treatment. Of that 4.06%, 46% of those individuals receive Pennsylvania mental health care coverage, and the remaining 53.3% have zero access to mental health care. So although employers do offer health care coverage, many employers do not have a balloon that covers mental health care coverage, and that would be a second form of insurance. And so mental health is like the most undercovered health issue that we have, and it just doesn't seem right to think that over half of the individuals that have severe mental health issues don't even qualify for coverage for mental health. Not everybody in the state automatically qualifies for mental health coverage, and although Governor Wolf did sign something in this year in January, he wants to improve access to mental health care coverage in the state of Pennsylvania. I don't feel like we're moving fast enough, and the initiative is just supposed to be able to give people access to the actual mental health coverage versus fixing the problem that exists within the mental health field itself. So even if you do have coverage, oftentimes, if you go to a hospital because you feel like you need inpatient care, you're turned away because you're either not qualified as a threat to yourself or a threat to other people. And so oftentimes, individuals who had been feeling suicidal, say previous to arriving at the hospital, they were really worked up, they were feeling like they were going to hurt themselves or kill themselves. By the time you arrive to the hospital, if you're not still feeling suicidal, oftentimes you'll get turned away. And depending on the number of beds that are available, they kind of like read through what your risk is, and then they decide whether or not you qualify for a bed. So some individuals might go in there and they ask, are you feeling suicidal? You might say, yes, I'm feeling suicidal. However, just because you're feeling suicidal, they want to know if you've considered the actual process of killing yourself. So then they ask the question, have you thought about how you would kill yourself or how you would harm yourself? And if you say, no, not really, I just kind of don't want to live, they'll say, okay, well, that's something that you can be treated as an outpatient, and see you bye, basically. So to be able to qualify to be hospitalized, even if you're feeling extremely suicidal, if you don't already have a plan to carry it out, then oftentimes you're turned away. And if they're already full and the beds are full, oftentimes they'll turn you away and they'll look for an open bed somewhere else. Now, some people don't have accessibility to get home. Say a bed is open an hour away from home. Some people have to turn down that bed because it's not readily accessible from where we're at. And when you get out, you're kind of like discharged, and they're kind of like, see you bye, and there's no real follow-up on how to get you home. So unless you have support people or somebody who can transport you, oftentimes you're just kind of forgotten about after you've been released. There's very limited access on how to get yourself to a hospital in the event that you are feeling a mental health crisis. If you call an ambulance, unless there's a medical necessity to transport you, generally they will not transport you, which is also a huge issue. So there's some people who maybe are at home feeling suicidal, they don't have a ride. If they had a support system, perhaps they wouldn't be there in the first place. And so they don't really have access to get to a hospital, even if they have the coverage. So, we think about a heart attack as a medical emergency, but we're not thinking about suicidal ideation as a medical emergency. So, there's some brokenness in that ideation to think that somebody who doesn't value their life is any less of an emergency than somebody whose heart is hurting physically. So that for me is like super frustrating. Also, if you go into the hospital and say you lash out on somebody and you punch them in the face and you feel like you're going to hurt them, you can be taken to the hospital. They'll ask you, do you still want to hurt them? Do you think you're going to continue to hurt them? And oftentimes you end up getting discharged, you don't get kept, and you end up getting charged with assault or something else. So some people who lash out, say they have mental health issues, oftentimes they get overlooked and they are sent away because they would rather criminally charge them than treat the illness that's causing the behavioral issues in the first place. Our system fails us so much. When I can speak from experience, when Robbie was taken to the hospital, the nurse told me that the insurance had said that Robbie was not necessarily a threat to other people because he hadn't actually done anything to harm them at that point. I grabbed the phone off the nurse and I spoke to my insurance directly, and I said, I don't know how you're telling me that he is not a danger when he just told me if I take him home tonight, he will rape his siblings. And I said, you need to reconsider. This mental health system is so broken. And I spoke to that lady on the phone for 20 minutes. So she actually ended up saying, well, let me talk it over with a supervisor. Based on qualification questions, I can't get you approved, but I'm going to go to bat for you. So sometimes we have to advocate and we have to really push and really make them consider, because maybe that first person tells us no, but then you have to push until you get to that second person and that third person and that fourth person. So no matter how many times somebody tells you no, just keep pushing, because you can get to that one person who might be willing to say yes. And as long as you get to the right person and you go above those people who tell you no, then you still have opportunity to get help. So in my situation, I just kept pushing and advocating and telling them that he was definitely a danger and I was not bringing him home. And so I advocated and I ended up getting it approved that he stayed in the hospital that night. And it's so frustrating though, because there's so many people who don't have somebody to advocate for them. So in that situation, had it been somebody different and there was nobody to grab that phone, they would have been sent home that day. And that's really scary to think that our health system is so broken that we literally view danger as somebody's going to die right now if this isn't taken care of. And so we really need to advocate and look at legislation and figure out how we can navigate this mental health crisis that we have going on. So many lives are lost every year to suicide, and they're just lives that don't need to be lost. And so for me, it's frustrating. And so I'm researching and looking at what I can do to make a difference. Now, obviously, I'm only one person, but one person can start a movement, and a movement can start change. So if we all band in this together and we all do our part to make a difference and start advocating and pushing, I think that we could make a real difference. I hope that this video has motivated whoever's watched to want to do something different to help fix our broken system when it comes to mental health. Also, if you're somebody who is feeling suicidal and you need help right now, one of the few things that you can do is call the Suicide Prevention Health Line. It's at 1-800-273 what is the rest? Talk. It's talk. 1-800-273-TALK, which comes out to 1-800-273-8255. So if you or somebody you know is feeling suicidal and they need to talk to somebody and they need reference to resources, no matter what state you're in, that is the National Suicide Prevention Hotline. If you're in total crisis and you need help right now, say you've done something and you need medical attention right away, please don't hesitate to call 911 directly. Let them know of your medical emergency, and they will be there hopefully within a reasonable amount of time. For anybody who is struggling and they just need somebody to listen, please feel free to reach out. I have listed my Facebook and my email in my About section, and I try to help as many people as I can. If you don't have resources, I will do my best to find resources. It's so important to me that nobody goes through anything alone, especially when it comes to families who are in situations similar to mine, where perhaps one of your children has pedophilia type beliefs or behaviors, and you need to protect your other children. Please reach out. Do not grieve alone. Do not go through that alone. Keep pushing, keep advocating. If you need somebody else and a second opinion, I am happy to give that to you. I am not a professional. I am just a mom who is supercharged, trying to make a difference, and we're all in this together. So if anybody is a victim or needs resources or needs just a friend, please don't hesitate to reach out. And as myself, I need to say that suicide is never the answer. If for some reason you're hurting and feeling suicidal, please reach out to a family member or a friend, or if you don't have anybody, please feel free to reach out to me. Suicide is never the answer. Being somebody who has overcome it myself, I will tell you it was the biggest mistake in my life, and suicide is never the answer. I love you all so much. Thank you for tuning in. Hopefully we can talk about further mental health crises and ways that we can make a difference. And thanks so much for tuning in. And if you haven't already, please subscribe to my channel for further videos and updates. All right, guys, love you all so much. Thanks for tuning in.